is another interesting edition of your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to finding lasting solutions. I am your regular anchor, Oshuomowa Daniels. Our focus this week is on infertility. We'll be right back to discuss that after our news segment. Please don't go away. Stay tuned. It promises to be very interesting.
In this program organized by HAI, empowered by LFR, to equip you with those skills that will improve the potential for accident victims to be alive at the end of the day. Not just accident victims, but any other person that may be suffering a cardiac problem in your family, in your workplace, in society. And we hope beyond here, this skill will go from you to other people. Congratulations.
Of all the people that will die from a traumatic incident, 50% will die in the first 1 to 3 minutes. And so by training these responders, we're definitely able to help reduce that burden of injury. So we teach them scene safety, making sure everything around you is safe before you go and help others so as not to harm yourself. We teach them to call for help immediately and ask if the patient would like their help. And then we teach them airway, breathing, and circulation. So we teach them how to do a head tilt chin lift maneuver to open the airway if they're not breathing. We teach them to put the patient in the recovery position if they are unconscious.
Collaboration with LFR International and Federal Road Safety Commission, we are training 350. You check among the agencies in Lagos, last mass personnel will almost be found in every nook and cranny, and so we expect that over 50% reduction in deaths can happen because last mass people are being trained.
The essence is to reduce casualties on Lagos Road. We need more and more of this training so that we can be of efficient and effective and responsive officials and personnel on the road.
The first responders training is actually what the Federal Road Safety Corps has been up to under the National Post Crash Care Initiative. So it's a really is a great one for the Federal Road Safety Corps. And then once they are trained, they shouldn't keep this training to themselves. They should train others because everybody needs to have the knowledge of first aid. Anyone can be a victim.
Usman, Billy Kisu, and several others here at the Gala Night held in Lagos State, Southwest Nigeria, are living witnesses to the impact of Emeka Okosa Foundation.
I was diagnosed of mitral valve stenosis. That was early 2021. Then they said I would need 11 million naira for the surgery, and I didn't have the money. And somehow we got to find out about this foundation, and he linked me up, registered me, and we went to Anambra. Then that was it. They did the surgery for me, absolutely free. I didn't pay a dime for it. I just want to say thank you very much because I really don't know where I would have been by now. I didn't even know I would be alive by this time.
My nephew benefited from the foundation because he had heart problems. So they did the surgery for him. So now he's free, he can walk, he can do so many things. So we are grateful to the foundation.
He has also been a great pillar of support for my son, Kanya Chuku, who you all know. Kanya Chuku is right now 13 years old. He's a boy living with autism. He started painting at the age of 5. And with the first time he met Emeka Okosa, Emeka Okosa, of course, was excited to meet him. And since then, they formed some kind of bond, some kind of relationship. I'm deeply honored. To be here and to be a part of all of this.
See that Emeka Okosa Foundation is helps on the sustainable development goals, and so that is the basis of the practice. And we go from the primary health care, where that is delivered from diarrheal diseases, immunization, family planning, to take patients. From there, we escalate patients who need secondary health care. And then we go on to specialty care, with the pinnacle of the services, cardiac surgery and cardiovascular care. So it's a whole comprehensive care package.
With a troubling statistics from the United Nations indicating an estimated 20 million Nigerian children from ages 6 to 18 not having access to education, the foundation is also helping to bridge the gap.
No matter how little you have, how much you have, it's always important to understand that there's someone that needs help, and that's really what keeps us going as a foundation, just knowing that the need is out there and we're in a position to actually help people. We have a lot of plans to pilot new programs. That includes building a skill acquisition center. It includes launching a program to help smallholder farmers. And with education, we want to help a lot more children. We also want to help university students. We have a national engineering program that we're also scheduled to pilot next year.
Motivation lies in empowering those in need and their communities. That turning a blind eye to a brother or sister's suffering is a failure in itself. This principle has guided me throughout my life. The ethos of giving back forms the cornerstone of the foundation's values, shaping targeted interventions that address fundamental needs and create enduring positive change. The Sir Emeka Okwosa Foundation is aligned with United Nations Sustainable Development Goals, the SDGs. Notable milestones have been achieved by our dedicated team. This includes awarding over 130 scholarships.
The Sir Emeka Okwosa Foundation is a Nigerian-based non-profit organization that began philanthropic activities in the 90s but was formally incorporated in 2011. The foundation has adopted a community-driven approach to its development initiatives that emphasizes working closely with community members to identify their needs and develop solutions that addresses their unique challenges.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Welcome back. The number of couples experiencing reproductive challenges is said to be on the rise in Nigeria, as fertility clinics seem to be springing up more than ever. The World Health Organization (WHO) estimates that about 48 million couples live with infertility globally, and Nigeria contributes a significant amount to these global figures. On the program this week, we have with us Chibuki Aigbe, a medical doctor with over a decade of experience in public health and fertility management, to discuss the issue with us.
I would first like to define what infertility is. Infertility is the inability of a couple or a woman to achieve conception after 12 months of frequent unprotected sexual intercourse. So infertility, because we really have very poor figures in Nigeria, we don't have data. However, we see from my own internal study, we see that it's quite high. On the average, we have about 15 to 20 people call us, reach out to us to make inquiries on the treatment options available to manage their infertility. What causes infertility? Primarily, I would like to break it down. I would say there are obstructive causes, there are hormonal causes. So for male causes, I would say the ability to have successful ejaculatory sex or sexual intercourse. There could also be a problem with the quality and the quantity of the sperm that's being released. So with male factor infertility, we're talking about the ability to have successful and ejaculatory intercourse. One of the major problems will be what we call erectile dysfunction, when men cannot successfully achieve and maintain an erection that would eventually cause ejaculation. Another problem is when there's a defunct or a problem with the quantity and the quality of sperm that we call low sperm count. Sometimes the count is there, but those sperms are not moving as they should, right? Sometimes the number is not enough. For normal ejaculation, a man ejaculates 15 to 20 million sperm cells, and we need just one to actually achieve pregnancy. However, people who have low sperm counts will give us less than 2 million sperms, and these sperms are not as motile. By motile, I mean they don't move the way they should. Some are default, their morphology is defaulted, so meaning that they're not shaped properly. So those things can also affect infertility. For women, I would say that another the biggest culprit with female infertility would be her ability to ovulate, ovulatory problems, which can be tied to hormones, can be tied to PCOS, which is polycystic ovarian syndrome. The commonest is the ovulatory problems that women face, and the biggest culprit is the PCOS, which is the polycystic ovarian syndrome, where women do not ovulate. Very commonly again is physical problems in the uterine cavity that will prevent a fertilized embryo from implanting into the uterus. And this is very commonly again is fibroid. So women who have fibroid have issues with implanting the fertilized embryo. So we would want to take care of that as well. So also the quantity and the quality of the egg that a woman has. Remember that every woman is born with the eggs that she's going to use for the rest of her life. So if she doesn't use them on time, I'm being as layman as I can, if you don't use those eggs on time, you will not be getting the best egg and the best sperm. And there are new treatment protocols that can arrest all of these that we can talk about later on in the show. Also, untreated infection or poorly treated infection can cause infertility, where the fallopian tubes, there are cilia in the fallopian tubes, there are hair-like structures that are called cilia that help to move egg and even fertilized eggs, which we call embryos, into the uterine cavity. Now, when this infection is not treated, those ascending infection is not treated, the cilia in that place in the fallopian tubes are damaged. Okay, so it can prevent sperm from actually reaching the egg and egg from being fertilized. Poor hygiene and even poor medical instrumentation. So women who've had medical instrumentations done, maybe they've had fibroid surgeries removed, they've terminated pregnancies. When those things are not done properly and instrumentation and you don't heal properly, so the instrumentation is done properly and healing is poor, then you heal with scars and adhesions that will prevent implantation from happening. Those are the very commonest causes of infertility. Two major culprits of infertility in Nigeria is culture and tradition, and also religion. Now, I say religion because a lot of people are blinded to their health and the effect and complications of their health because of religion. So they keep on wallowing in faith, and my religion tells me that faith without works is dead. So we struggle with that, and then we also struggle with the cultural and traditional beliefs. Sometimes we say infertility is not in my lineage, infertility is not in my family, infertility is not my portion, or my mother didn't have fibroids, so I will not have fibroids. So things like that. That has affected what our fertility is like and how we're able to manage infertility here in Nigeria. Other factors would include knowledge. A lot of people really don't seek help because they do not know that there's help. And they do not seek help from the right sources. They also do not seek help in fact, you need to know that there's help to be sought before you even go after seeking for help. And then you also need to seek help from the right place. So that's also a factor in our management of fertility and infertility. Another major factor is our socioeconomic background or levels. Take, for instance, a lot of women and men over time, the age for having their first child has gradually increased. I remember in my parents' days, people got married in their 20s. Now that doesn't happen anymore. And in case we don't know, as we age, we reduce our ability to achieve conception spontaneously. What do I mean? Both male and females, the quality of their gametes, be it sperm or egg, reduces with age. Quantity and quality reduces with age. So, because a lot of people are pursuing greener pastures, pursuing better life, pursuing better finances, people don't tend to, try for children as early as they should. And this affects their ability to conceive spontaneously. Both men and women have a 50% contributory factor to achieving conception, having a successful pregnancy and carrying it to term. There's a 50-50% contributory factor. Women come to the forefront is the representation of our culture, because culturally here in Nigeria, when a woman or a couple has not achieved conception, the woman is being blamed for it. However, there's a 50-50% contributory factor for both the male and the female in trying to achieve conception. So we see that here in One Wellness Center, we would love to see whenever a woman comes in to seek for answers, get help, we always like to involve her partner, be it husband, be it donor, whatever, her partner, to come in so that we can carry on with the treatment with the both of them from the beginning.
What are the available options for people to achieve pregnancy with this challenge of infertility?
So first off, something I'm very excited about, and I'm always very quick to talk about, is the ovarian rejuvenation. This is a solution that occurs when a woman's eggs are not optimal. So, remember I talked about women who don't have their kids on time, so the quality and quantity of eggs have been decreased. Now, it's a treatment protocol that's available for that purpose. What we do is that we help, rejuvenate the ovaries so that she can have viable follicles and eggs for fertilization. We also have the intrauterine insemination, where we'll bring the sperm up to the egg. We have the IVF, which is in vitro fertilization, where we stimulate a woman to produce eggs. We retrieve those eggs, we put it in a petri dish, and then we get the man's sperm, we put it in a petri dish, we let fertilization happen, and then we do the implantation. We also have the ICSI, which is the intracytoplasmic sperm insemination. So we have the ICSI, the intracytoplasmic sperm insemination, where we inject one egg we get to select our sperm, and then we inject that chosen sperm into the egg to make sure that fertilization happens. There's always a treatment protocol. So you need to first, like I said, speak to the right person. You need to speak to the right person to get the correct solution and the legal solution. People do things like, there's also surrogacy in the event that you cannot, for personal reasons or even for medical reasons, you cannot even you don't have the physical ability to carry the pregnancy. Surrogacy does exist. Okay, there's also sperm donation, there's egg donation, there's also adoption. These are all viable methods and legal ways to which you can have your child. Surrogacy is having an external person, an external woman who is not the biological mother or biological father carry the pregnancy. So it's just a cavity, I would say. We're just using another woman's uterus to carry your own child. So the intending mother and intending father would use their gametes will fertilize their gametes, their egg and their sperm, and have a fetus, have an embryo, and implant that embryo into the surrogate. So that's what surrogacy is.
Looking at the economic situation in Nigeria today, how accessible is this option to people, especially the middle class or the less privileged?
It's affordable. I mean, we all know that healthcare is not cheap, but it is very affordable. And there are some private bodies, financial institutions that give instruments, financial instruments for women who can't afford these treatments. Also, we would employ the government to try to subsidize healthcare, one, and two, provide grants to women who are in dire need to achieve pregnancies.
Thank you for coming on the show. We appreciate you. Thank you very much.
If you are just joining us, it's Health Affair on AIT, and next on the program is our nutrition segment, a part of the program that focuses on eating right to stay healthy.
Tiger nuts, also known as earth almonds, were one of the first plants cultivated in Egypt and traditionally used as both food and medicine. Tiger nuts are rich in a variety of nutrients and have been linked to several health benefits. Tiger nuts are rich in antioxidants, which are beneficial compounds that protect your body against aging and diseases like cancer and heart disease. Tiger nuts also promote digestion in various ways. Contents of tiger nuts are as follows: calories 103 to 121 grams, fiber 2 to 7 grams, carbs 9 grams, protein 1 gram, fat 7 to 9 grams, vitamin E 278% of daily value, iron 13 to 40% of daily value, phosphorus 9 to 11% of daily value, vitamin C 2 to 8% of daily value, magnesium 3 to 5% of daily value, zinc 5 to 7% of daily value, potassium 3 to 5% of daily value, and calcium 1% of daily value.
Join us on our clinical segment where we'll give you tips for healthy living.
TB is a chronic infection caused by Mycobacterium tuberculosis. TB has symptoms like cough of two weeks duration, weight loss, night sweat, hemoptysis, fever, and chest pain. TB can be prevented. TB is curable. Taking your drug for 6 months, you'll be free of TB. You'll be totally free of TB. And lastly, the diagnosis and treatment of TB is free.
This is where we'll wrap it up this week. Thanks for spending your time with us. Please join us same time next week for another interesting edition of the program. And please endeavor to advertise your health product and services on the platform. I remain yours truly, Oshomowa Daniels. Please keep staying safe.